representatives from the Health Working Group and the Life Sciences and Innovation Forum, distinguished guests, ladies and gentlemen, good afternoon. It's my pleasure and honor to join you in the beautiful city of Cebu for this year's high-level meeting on health and the economy. As the chair of the Health Working Group, please allow me to extend my warm welcome to you all for your participation. I would also like to thank our host economy, the Philippines, for their efforts to organize this meeting. The high-level meeting on health and the economy is an important event jointly held by the Health Working Group and the Life Sciences and Innovation Forum. It is committed to providing a high-level platform of dialogue for government officials, international organizations, NGOs, academic institutions, and health industry from all member economies on the important issue of health and the economy. At the same time, the high-level meeting also provides a model under the APEC framework for different fora to effectively communicate on health-related work and jointly advance APEC health cooperation. With this platform, members of HWG and LSIF share information, seek cooperation, and coordinate efforts for the benefit of people's health and economic development in this region. Since the first high-level meeting on health and the economy in 2011, the HWG has always attached great importance and given support to the yearly event. And each year, this meeting has had attendance by health ministers from various member economies. At last year's meeting, the Healthy Asia Pacific 2020 initiative was adopted, setting a strategic direction for the APEC Health Cooperation Agenda in the coming 5 years. The initiative was submitted to the 2014 APEC Economic Ministers and also finally listed in the Leaders' Declaration. Building on the past achievements and consensus reached, we expected to continue this momentum by developing the Healthy Asia Pacific 2020 roadmap. And we hope it can be discussed at this meeting. The essence of Health Asia Pacific 2020 is to call on APEC economies to develop sustainable and high-performing health systems by adapting health in all policies and whole-of-government, whole-of-society approach to achieve people's health and well-being throughout the life course. Achieving the goals of Asia Pacific 2020 requires strong government commitment and leadership. Understanding of the value of health to economic growth and development should be enhanced across different sectors of government. To ensure better health requires an overall healthcare expenditure consistent with rising levels of economic development, and healthcare requires healthcare resources should be allocated effectively. Ladies and gentlemen, we will soon turn over the leaf of 2015. There are still MDGs that remain unaccomplished. We need to continue the unfinished business of MDGs in the context of universal health care. We need to increase our investment on the health of our population at all stages of life. We need to develop sustainable healthcare financing systems and promote social protection. We also need to enhance regional cooperation in health security to be better prepared for health emergencies. There are many more health issues need to be addressed. Therefore, we need your insights and your solutions. On that note, I wish this meeting a great success. Thank you. Now I turn the floor over to the planning chair of LSIF, Dr. Yuan McFarland, to deliver welcoming remarks.
Excellent, thank you very much. Ministers and distinguished guests, my name is Ryan McFarland. I am the Life Sciences Innovation Forum Planning Group Chair and also the Principal APEC Coordinator at the U.S. Department of State. And it's truly a great honor for me to welcome you to this 5th high-level meeting on health and the economy. As noted, the high-level meeting is a joint initiative between the LSIF and the Health Working Group, and it really looks to elevate the nexus between health and the economy and facilitate high-level attention to key issues that are identified by senior health and economic stakeholders. The LSIF is a tripartite group that is led by our Executive Board Chair, Secretary of Health of the Philippines, Dr. Janet Garin, and assisted by our academic, government, and industry co-chairs, Professor Peter Sheehan, Mr. Nares Damrongchai, and Dr. Fikri Isaac. We have a fantastic agenda today, and as a former biomedical scientist, I am personally very excited about the discussions we'll have over the next few days. Before we get started, I would just like to briefly note how the Life Sciences Innovation Forum is contributing to the 2015 APEC priorities. As many of you know, the LSIF was established by Leaders' Mandate in 2002 to shape policies that will contribute to the development of the medical life sciences sector and ultimately the improvement of public health in the APEC region. To achieve this, the Life Sciences Innovation Forum has focused on 3 areas: research and development, regulatory harmonization, and health policy innovation. Just to demonstrate the cross-cutting nature of our work, I do sincerely believe that the Life Sciences Innovation Forum is contributing to all 4 of the 2015 APEC priorities. In terms of enhancing regional economic integration, our work on regulatory harmonization, I feel, is a key component of this and an important contribution to APEC's goals to create a seamless regional economy in the Asia Pacific. In terms of fostering SME participation in regional and the global economy within the LSIF, we are supporting work to improve the business ethics environment for SMEs in the medical device and biopharmaceutical sectors. In terms of investing in human capital, this is something that we are contributing to through the various trainings that we are conducting throughout the region. And finally, in terms of building sustainable and resilient communities, you really can't have a growing and sustainable economy without first having a healthy economy. And I believe our work with the Global Health Security Agenda on infection control infrastructure is a key contribution to this pillar. So in conclusion, I'd just like to say that I am very much looking forward to the discussions on the types of innovations and partnerships needed to achieve a healthy Asia Pacific 2020 and the implementation of this initiative through the 2020 roadmap. And with that, I'd like to ask Mr. Charles Goddard, Global Editorial Director at the Economist Intelligence Unit, to introduce our keynote speaker.
Thank you. Good afternoon, ministers, distinguished guests, ladies and gentlemen. My name is Charlie Goddard. I'm the editorial director for the Economist Intelligence Unit in Asia. I want to welcome the ministers particularly. There are ministers from Papua New Guinea, ministers from Chinese Taipei, the Philippines, of course. In a second, I'll introduce the Secretary, Brunei, and Indonesia. I just want to say how delighted I am to be here helping facilitate this high-level working group on health and the economy, this 5th APEC working group on health and the economy. What we're doing in our own Economist series is takes, I think, a cue from many of the issues, the leadership indeed, that the APEC high-level working group on health and the economy gives. And in particular, we look at many of the issues around the economy and the impact of healthcare and illness on the economy, and indeed on social inclusion and on inequality. The first speaker this is something I know deeply of concern to the first speaker. She's said so on 2 or 3 occasions at our own events and other events around the region. Let me just say that she has had a history of working around these issues. She's a medical doctor. She's a legislator, responsible in part for some of the extraordinary moves forward on things like the sin tax, on reproductive health care in the Philippines. She has been particularly eloquent around the whole question of social inclusion, and I know that that is going to be the focus of her address to start this off. It's my great pleasure to introduce from the Philippines, Dr. Jeanette Garin, the Secretary of Health. Dr. Garin. Would you like to just, I think from the seat, if that's okay, because I think what we'll do, I've been told that I'm apparently the only person allowed to speak from here, in part to make sure that that we encourage you to use this as a round table, really, so that you can talk and you can interact and ask questions and make it as informal and as interactive as possible.
Thank you very much, Charles. Honorable ministers, distinguished guests, ladies and gentlemen, good day to you and welcome to the Philippines. It was raining yesterday, but when most of our guests arrived, the sun decided to come out. So she's not shy anymore because we have guests from all over the world. And I am very pleased to welcome you to the 5th high-level meeting on health and the economy, a meeting that is a very productive joint initiative between the APEC Life Sciences Innovation Forum and the Health Working Group. APEC leads the way in looking at the effect of health on the economy, innovative ways in which we can promote good health to stimulate and sustain economic and social development. Good health allows citizens to reach their full productive potential, as we all aspire, and the innovations that drive good health provide an economic return that is outstanding. At the high-level meeting in 2012 in St. Petersburg, we shared the results of an LSIF study that showed a return of $30 to $1 for investment in innovations and innovative approaches to maternal and child health. Indeed, each government and each economy would always look at investments, priorities, and innovations, and how we can actually maximize each of these. And we are excited about the robust health and life sciences agenda in APEC this year, particularly improving efficiencies in the health system, building human capacity, and sharing the strengths of our health workforce with others. By sharing, we actually resolve many problems. Lessons learned should be lessons in the past, and lessons learned, mistakes in the past, should not be allowed to be repeated mistakes in other countries. Those with grave consequences has actually been resolved by all of us sharing information with each other. Regulatory convergence of medical products, and of course, addressing the impediments in the medical product supply chain, including building capacity for common product data standards and ethical business practices. The Philippines is committed to working with you on all of these priority areas. The world today is at its wealthiest, yet aspects of poverty and inhumanity continue to exist even in areas where we thought we have triumphed. We live in a time that distinctly depicts the convergence of disease patterns found in both developed and most developing countries, not only in the Asia-Pacific region, but worldwide. Our nations suffer from a double burden of diseases as we struggle to overcome infectious diseases, maternal, newborn, and child health problems, as well as nutritional deficiencies and chronic diseases, including mental illnesses. So what can we do in APEC to help address these challenges? APEC is a very good incubator of ideas, and it is an early adopter of innovative initiatives, especially so in the health and medical sciences arena. This year, I am proud to preside over a meeting that will discuss the results of a number of new initiatives and provide recommendations to our leaders on key priority actions. You and all of us have important voices in the four corners of this room, which will actually echo to every household and to every village in the global perspective. First is actually Healthy Asia Pacific 2020. In 2014, under the chairmanship of our colleagues from China, APEC agreed on an initiative to promote a healthy Asia Pacific by 2020. And that means not only making each of our countries healthy, but making our whole neighborhood healthy. Because the impact of health on any of the country in Southeast Asia and the Pacific will actually have dire consequences affecting the whole region. Thus, families is not limited within our individual countries. Families actually transcends to every neighbor, to every country in the whole region, because we all came from one species, and that is why we are all here this afternoon. And this year, our officials have worked hard to develop a roadmap for the implementation of that initiative. And implementation of this roadmap would go a long way to addressing the struggle we all are facing on infectious and chronic diseases. Our job, therefore, is to endorse this roadmap and identify key areas where each of us can take a lead in collective implementation. The roadmap should not be left in the four corners of this room. The roadmap should not be left in the city of Cebu. It should be a map that all of us together, we should embark, where individual responsibilities as a government should be fulfilled, and our collective obligation to deliver for our people will be a goal that we can all achieve. Next would be the issue of infectious diseases. We continue to see an alarming rise in infectious diseases, and most importantly, those acquired in healthcare and institutional settings. We are also troubled by a rise in antimicrobial resistance, a challenge to all of us because healthcare workers who are actually frontliners in saving our governments and in saving our societies are inflicted with challenges all over and across the global nation. Dengue has spread rapidly throughout Southeast Asia and is increasing on the other side of the Pacific Ocean. We welcome the development of the world's first dengue vaccine, and the widespread use of these vaccines will be of great social and economic consequence to member economies where dengue and malaria are endemic. And of course, the implication there will be affordability. This, of course, will not be difficult if you all work hand in hand, helping those who need most, and those who have more will be helping those who have less. APEC is leading the way once again in addressing healthcare-associated infections and antimicrobial resistance. The collaboration between APEC and the Global Health Security Agenda is a proof of a much-needed partnership. APEC can offer very practical implementation of the action packages that emerge from the forthcoming GHSA meeting in Seoul. APEC also is addressing comprehensively the root cause of a number of infectious diseases, the lack of a safe blood supply. I commend those who are devoting time and resources to launch the APEC Blood Supply Chain Partnership Training Network, which will help build the capacity of our laboratory managers and blood bankers and help them achieve international accreditation. Truly, this is a problem that, if left resolved, can actually save many lives. Third would be on the issue of chronic diseases. The Philippines and its neighbors are plagued by a rise in chronic disease. Musculoskeletal and cardiovascular diseases, diabetes, and cancer are stripping our people of their enjoyment of life, their families, and their working potential. While governments and families strive to reduce poverty, the economic goals that was able to transcend in every family can easily be wiped out with the entry of a chronic or a debilitating disease into a member of that family. All the years of hard work can actually be deleted by a single illness. And this is, again, where governments and the private sector are expected to help. Mental illness, up until quite recently, was considered a silent but insidious chronic disease. It is now recognized as a priority that can and should be addressed openly and well. Mental and physical well-being are now equal partners. Many mental illnesses can be prevented and all can be treated, allowing a culture of mental wellness to emerge and flourish. If we reflect on some peculiar accidents recently, some schools being attacked by gunmen, festivities being bombed by presumably mentally ill suspects, the impact of the community or the society having many victims simply because society failed to recognize the early signs of mental illness. The consequences of such action is something that should not happen again. Moreover, are we starting to realize the implication that these events, these unfortunate accidents, these tragic incidents could have been well prevented? Unfortunately, on some occasions, we fail to recognize the importance of giving this aspect, this niche, this sector in our society, their much needed attention. And we also have people who are inflicted with mental illnesses that if they will be given the attention, the medications, the treatment that they need, can actually remain as productive members and as contributors of the economy of our individual countries. I am very pleased that the Philippines is taking a leadership role this year in promoting mental well-being. APEC has a very robust and innovative agenda to promote mental health and reduce stigma. APEC's mental health meeting in Manila on August 25 addressed the needs and priorities of economies and paved way for the launch this year of a digital hub to promote innovative collaborations between governments, the academe, the private sector to address these needs. The Philippines is, of course, a proud partner during the launch of this hub. Fourth is the fiscal implications of ill health. Engaging our budget and finance planners in our effort to mitigate the social and economic effects of ill health is a priority. Economic planning and finance communities look at health as a cost. This should not be. Health should be regarded as an investment, without which will result in astronomical costs to governments, corporations, and our citizens. We all have heard about what happened to West Africa because of Ebola. MERS-CoV is a continuing threat, not only in the Middle East, but also in their neighboring countries and even throughout the world. We even have teenage pregnancy that, if not invested on properly, will actually ruin the holders and the handlers of our future. And these are actually our young generation. HIV is also a problem. Outbreaks, and the increasing burden and out-of-pocket expenditure. All of this can actually be resolved by proper partnership with our budget and finance planners who would understand that an investment in health is actually because of the fact that health acts as a core, as a heart that pushes adrenaline into every aspect. If we talk about poverty reduction, health plays a role. If we talk about education, economies, agriculture, science and technology, and even climate change, there will always be investments on health. We are going to hear today the preliminary results of a study commissioned by the LSIF and ABAC on the fiscal impacts of ill health. As more people are forced to retire early because of ill health, the economy will become less productive and social welfare budgets will be severely strained, and our work to alleviate poverty will be undone rapidly as significant segments of the population are thrown back into poverty. In that regard, the Philippines has joined other economies in responding to the global call for universal health coverage. Certainly, our healthcare system is changing for the better, similar to other countries, most especially our neighbors in Southeast Asia. We have expanded the membership of PhilHealth, what we call our social health insurance, to include the poor and the near poor. We have increased the benefits of such, and since 2010, we have made significant investments in health facilities. But investment did not just stop on health facilities. It's a combination of human resource, the elimination of age-old infectious diseases, e-health, and other existing public health programs. But of course, sustainability would always be maximizing health insurance, the link that allows each of the aspects of healthcare to be sustainable. The passage of several landmark health legislation, and of course we owe it to the extreme political will of our president, such as the Responsible Parenthood and Reproductive Health Act, the Act restructuring the excess tax on alcohol and tobacco, otherwise known as the Sin Tax Law, and the National Health Insurance Act of 2013, an act to effectively instill health consciousness through graphic health warnings on tobacco products, exemplified whole of government and whole of society approaches on health reform. Performance-based allocation has also been a focus of our country. The focus on quantifiable outputs with emphasis on how health provides impact on a local setting has pushed us to consider the High Impact 5 strategy. This actually simplifies our targets to 5 major and core programs. That's maternal care, infant care, under 5 care, HIV/AIDS, and the health service delivery network. We have recognized that the consequences of pandemics extend not only to health, but also provides major impact on social, political, and economic environments, as we have seen with Ebola. Thus, we are also focusing our efforts in pandemic preparedness and emergency response. Investing on response is something that has actually allowed Southeast Asia and the Pacific to be prepared on other emerging infectious diseases. The government of the Philippines recognizes that improved access to healthcare not only promotes good health, but also contributes to labor force productivity, employment, and eventually economic growth. We recognize that investing in health is critical for reducing poverty and promoting inclusive growth. Simply said, investing in health is actually leaving a legacy that would allow our people to say and to tell us that their ancestors cared to prepare. And we know the importance of placing a gender lens on diseases that impede the participation of women in the economy. I am particularly pleased to see this issue addressed in APEC. Once again, the forum is leading the way. We now have a toolkit for all of us to use in promoting women's health. And I know the efforts to start young, using life-saving vaccines in the region to guard against cervical cancer. Building a cohesive outlook on the management and control of lifestyle-related non-communicable diseases requires evaluation of genetics, diet, environment, and social factors, among others. How such diseases arise echo the health value chain in the birth of the new interventions in health. New discoveries are made which later develop into habits or systems. The HLM is a great opportunity for all of us to network and help forge a greater understanding of the challenges and opportunities for healthier future, sustainable growth, and economic empowerment for all segments of society. We support the framing of a health innovation policy that can be made firm through harmonization of regulatory practices and science in partnership with institutions. We also support the continued setting up of centers of excellence within the Asia and Pacific that will sustain the efforts of the Regulatory Harmonization Steering Committee through the roadmap supported by a confluence of resources and assistance. APEC provides a unique platform for promoting innovation in the health sector in the Asia-Pacific region, and at the same time supporting the broader trade and investment agenda. We hope to be able to reap the meaningful results from the APEC platform of liberalization, facilitation, and economic and technical cooperation for both human and economic development. It is a privilege to be with all of you today, as it is a privilege to be a part of a team that is shaping and molding the world for a better place to live in. And we were able to do this, creating a roadmap, initiating programs, initiating talks, and putting forward recommendations to our leaders, because we actually put foremost in our agenda health. Health that transcends across all sectors of our society. Health which is the heart that allows economies to pulsate with exact precision, targeting the ultimate goal not only of better economies, but providing for a better quality of life among our societies. I look forward to a productive meeting today. Thank you, and mabuhay.
Thank you very much, Secretary Gurin. I believe this is the moment at which the media has to leave the room. If you would just depart at the back. Thanks very much indeed.